Welcome back to Bloom. People who have been told they must have invasive back surgery now have a new option with a new minimally invasive technique created by a neurosurgeon who is transforming spinal surgery with this revolutionary procedure. Joining us to discuss this minimally invasive spinal fusion for back pain is neurosurgeon Dr. Hamid Abbasi. Welcome to Bloom, doctor.
Well, thank you very much for having me.
Oh, it's great to have you. So, Dr. Abbasi, explain how you are helping people who have been told that they have to have major invasive back surgery. I understand that you have perfected a new technique that isn't as life-altering.
Well, we have been performing spinal surgeries for almost 70, 80 years. This kind of fusion is necessary when the discs go out. The disc is like a tire of a car that cushions the two bones against each other and keep the space open for the nerve to pass through. A spinal problem is very common. As a matter of fact, by the time you're 70 years old, if you never had a spine problem, you're among 1 to 2% of the population. Many of these patients we can help without the surgery, but when you need a surgery, we have to get to that disc which is inside of you. We can cut open your belly, or we can go from the back, and the way of getting there, we destroy the entire musculature in your spine just to get in. Now we don't have to do that anymore, and our patient benefit from us not filling you open to get where the problem is.
Yeah, I understand this breakthrough is incredible because it has minimal downtime and you don't have to do the large incision that most of us fear.
Many of our patients are actually farmers. I work and practice in the central and Minneapolis and central Minnesota. And as we know, farmers are the hardest working people. Even farmers, they go back to work within a week or two, whereas after open old-fashioned surgery, that could be easily 3 to 6 months before they can do basic daily activities. Now we send them back to their life so much faster.
So right now we're watching video of a patient of yours who is walking just 2 hours after back surgery. Who was a candidate for this incredible breakthrough treatment?
Well, in many cases, we can help the patient without the surgery. In many cases, that patient needs a surgery. We can just take the pressure off the spine. But if the disc is in such a situation, like a tire of a car that has 20 holes, you cannot repair that anymore. You need to get rid of that because those pieces of disc push on the nerve, and that's extremely painful. In those cases that disc is beyond repair, we go over a tube that is barely bigger than this pen, and we get the pieces of bad disc out and space it. And this patient actually, where you just looked at, came all the way from Canada to get this surgery, because once patients know what is the difference in downtime and the damage is old-fashioned way or the way we do that, they always choose to go with the minimal invasive route.
So, doctor, I know many times we hear of patients who have undergone major back surgery, but then they continue to have problems. Can you help them with your closed procedure?
Absolutely, absolutely. And many times in the old-fashioned surgery, we destroy lots of muscle, and people sort of start a problem for the future, for other level. Unfortunately, we have a saying, we say spine surgery begets spine surgery, because in the first surgery, we destabilize your spine. Many of those patients, when they come back to us, we can help them with a minimal invasive fashion and help the next level, or even the level that was done minimal invasively, by reducing the amount of the damage that is done during the surgery. We are preventing them having more problem in the future.
Doctor, this is so incredible to hear, and I know so many millions of Americans suffer with back issues. It's great to know that you're there and able to help them. And I want to give folks your information. If you want the doctor's information, the website to visit is inspiredspine.com. Dr. Abbasi, thank you so much.
Thank you very much. It was a pleasure being with you.
Likewise, and there is more Bloom just ahead. Stick around.